everyone, and welcome. If you're gearing up for your phlebotomy certification, you already know that precision is absolutely key, especially when you're working with the tiniest of patients. So today, we're going to break down exactly what you need to master capillary collection, feel confident in your skills, and of course, ace that exam.
So here's our game plan. We're going to start with the absolute non-negotiable rules. Then we'll walk through every single step of the procedure from prep all the way to handling the sample afterward. And to finish up, we'll do a quick-fire review of the most critical points that are almost guaranteed to show up on your exam. Sound good? Let's dive in.
Okay, first things first. Before you even think about picking up a lancet, you have to know the rules. And these aren't just, suggestions. They are the foundation for patient safety and making sure the sample you collect is even usable. This is what protects both you and your patient. I want you to think of these three groups as your guiding lights. First, you've got CLSI, who sets the standards for the how-to of the procedure, like that super important order of draw and puncture depth. Then there's OSHA, who's all about keeping you safe, focusing on things like proper sharps disposal. And finally, the CDC and state programs give us the quality rules for collecting those dried blood spot samples. The key is, they all work together to create one safe, seamless workflow.
All right, this one is huge, and you'll definitely see it on your exam. There's a very specific logic here. We grab blood gases first because they're sensitive to air. Then, we go for EDTA tubes before the blood has a chance to start clotting. After that, we get any other tubes with additives, and we always collect serum tubes last, since they're the ones we actually want to clot. You have got to memorize this sequence. It's absolutely critical.
Go ahead and burn this number into your memory. 2 millimeters. That is the absolute deepest you can ever go for a neonatal heelstick. And why are we so strict about this? Well, if you go any deeper, you risk hitting the baby's heel bone, the calcaneus, and that can cause a really serious infection called osteomyelitis. This is probably one of the most important safety limits you will ever learn.
So what's the big takeaway here? It's that these rules don't exist in a vacuum. A perfect collection means you're doing it all at once. You're following that CLSI order of draw, you're using a lancet that won't go deeper than 2.0 millimeters, and you're immediately getting rid of it according to OSHA's rules. It's all about weaving these standards together into one single safe habit. Okay, so we know the rules. Now let's talk about what this looks like in the real world before you even touch the patient. This is what we call the pre-analytical phase. And honestly, this is where you can prevent most errors before they ever have a chance to happen. This checklist is your best friend. Seriously. Verifying the patient's identity with at least 2 separate identifiers is what prevents major mistakes. You'll quickly assess the baby to make sure they're doing okay. And of course, getting all your supplies ready beforehand means you're not scrambling later. Remember this, a calm and prepared phlebotomist usually means a calmer baby and a much better sample. All right, it's time for the main event, the procedure itself. When you're collecting a dried blood spot, or DBS, sample, every little detail counts. This is where your knowledge and your steady hand all come together to get a perfect sample on the very first try. Let's walk through this. First, warming the heel is a game changer. It gets the blood flowing. Then, you clean the site and, this is crucial, let it air dry completely. Any leftover alcohol can mess up the sample. After one quick, decisive puncture, that lancet goes immediately into the sharps container. No exceptions. And finally, you always wipe away that first drop of blood. It's full of tissue fluid, and we want pure, clean blood for our sample. Okay, pay close attention, because this part is absolutely non-negotiable. You can only perform the puncture on the fleshy, rectangular parts on the very bottom of the heel, either on the inside, which is medial, or the outside, the lateral side. You never, ever puncture the back curve or the middle arch. That's where you risk hitting bone, nerves, or tendons. Knowing this anatomy is just fundamental to safe practice. This slide shows one of the biggest mistakes people make. If the blood isn't flowing well, you can apply gentle pressure, but do it a few centimeters above the site. What you should never do is squeeze or milk the area right around the puncture. Why? Because that forces out other fluids from the tissue, not just pure blood, and it can actually damage the red blood cells. Both of those things will ruin the sample and mean a painful do-over for the baby. Think of this as your quality checklist right at the bedside. You're aiming for a single, big drop of blood to fall right onto the center of the circle. You want it to soak all the way through so you can see it clearly on both sides.
Never ever layer little drops on top of each other. That messes up the test. And of course, the collection paper should never touch the baby's skin. That's a surefire way to contaminate the sample.
If you can just repeat this little phrase to yourself, you'll have the core of a perfect DBS collection down. One drop, one side, full saturation, and then a horizontal dry. It's short, it's sweet, and it's your best defense against having a sample rejected.
So you've got the blood on the card. Great. But your job is not done yet. What you do next in the post-collection phase is just as important for making sure that sample is still good when it arrives at the lab.
Once the bleeding has stopped, the next critical step is to label that card. This has to happen right there, at the bedside, while you're checking everything against the baby's ID band. Then comes the drying. The card has to be laid flat, horizontally, and kept away from heat or direct sunlight. Let me be really clear here. If you stack wet cards or trying to use a fan to speed things up, you will ruin the sample. It's a guaranteed rejection.
It's so frustrating, right? You feel like you did everything perfectly, and yet a sample can still get rejected by the lab. So let's talk about the most common reasons why that happens so we can avoid them and prevent a redraw.
Do you see how almost all of these go right back to the techniques we've just talked about? QNS, or quantity not sufficient, happens when you don't get that full, saturated spot. Layering, contamination, improper drying, all technique errors. And of course, simple things like letting the card sit too long before sending it or getting the label wrong can make a perfect sample completely worthless. Knowing these pitfalls is the key to prevention.
Phew, okay. We have covered a ton of ground. So let's wrap this up with a lightning round review of the absolute most important high-yield facts that you need to have locked and loaded for your certification exam.
Yes, you are seeing this number again, and for good reason. If you only remember one single number from everything we've talked about today, please make it this one, 2.0 millimeters, the absolute maximum depth for a neonatal heel stick. It is that important.
And here it is again, your other must-know piece of information. I want you to visualize it, say it out loud, whatever you need to do to drill this sequence into your brain. Blood gases, then EDTA, then other additives, and finally, serum. You can bet you'll be tested on this. And finally, let's just rapid-fire these last few exam topics. You need to know the heel safe zones like the back of your hand. You have to know that blood gases get sealed and mixed right away. Master that horizontal drying procedure. And be ready to explain why we never, ever put an adhesive bandage on an infant. It's a serious choking hazard and can tear their very delicate skin.
Look, at the end of the day, this is about so much more than just passing a test. It's about earning the immense trust that's placed in you to care for the most vulnerable patients we have. The knowledge you've picked up today is your foundation for a career built on safety, precision, and genuine care. You've got this. Good luck.